palliative care is often misunderstood. Many people equate it with hospice, thinking it is only for the last few weeks or days of life. This is a fundamental misconception that limits its power. In its truest sense, palliative care is about improving the quality of life for patients and their families facing the problems associated with life-threatening illness. It is a specialized form of medical care focused on providing relief from the symptoms and stress of a serious condition. The goal is not just to manage pain, but to treat the whole person, their physical, emotional, spiritual, and social needs. It is about living, not just about dying. This approach is a profound shift from a purely curative model of medicine. For decades, the primary objective in healthcare has been to extend life, often at any cost. We have become incredibly skilled at fighting diseases with aggressive treatments, surgeries, and medications. Yet, in our relentless pursuit of a cure, we sometimes lose sight of the person experiencing the illness. Palliative care steps into this gap. It works alongside curative treatments, offering an extra layer of support. It asks the crucial questions. What is most important to you? What are your goals for your life, even with this illness? It is about aligning medical care with a patient's personal values. Imagine a patient undergoing chemotherapy for cancer. The treatment might be saving their life, but it also brings debilitating nausea, fatigue, and anxiety. A palliative care team would work to control these symptoms, making the treatment more tolerable. They would also provide counseling to help the patient and their family cope with the emotional turmoil. This is not about giving up on a cure. It is about making the journey manageable. It is about ensuring that the days a person has are as good as they can possibly be, filled with as much comfort and meaning as possible. This is the simple, powerful promise of palliative medicine. The team itself is a core component of this philosophy. It is rarely just one doctor. Instead, it is an interdisciplinary group of specialists. This team typically includes doctors, nurses, social workers, chaplains, and other trained professionals. Each member brings a unique skill set to address the multifaceted challenges of a serious illness. The social worker might help with navigating complex insurance issues or arranging for home care. The chaplain can offer spiritual guidance and support. This collaborative approach ensures that no aspect of the patient's well-being is overlooked, recognizing that human suffering is rarely confined to a single physical symptom. One of the most critical evolutions in palliative medicine is the understanding that it must begin much earlier. The traditional model of waiting until all curative options are exhausted before introducing palliative care is deeply flawed. For patients diagnosed with long-lasting chronic illnesses, such as advanced heart failure, COPD, or dementia, the journey can be long and arduous. Introducing palliative support at the moment of diagnosis can fundamentally change the trajectory of their experience. It allows patients to establish a relationship with their care team, build trust, and proactively manage symptoms before they become overwhelming crises that lead to repeated hospitalizations. Starting early provides the gift of time. It gives patients and their families the space to have difficult but necessary conversations about their hopes, fears, and preferences for care. These are not one-time discussions, but ongoing dialogues that evolve as the illness progresses. When these conversations happen early, they are less likely to be held in a state of panic or emergency. A patient can thoughtfully consider what trade-offs they are willing to make. Do they prefer aggressive treatments that might offer a small chance of longer life, but come with severe side effects? Or do they prioritize comfort and time at home with loved ones? There are no right or wrong answers, only personal ones. This early integration also has proven clinical benefits. Studies have consistently shown that patients with serious illnesses who receive palliative care alongside their standard treatment report a higher quality of life. They experience less pain, less depression, and less shortness of breath. Surprisingly, in some cases, they even live longer. This is not because palliative care has some secret curative property. It is because when a patient's symptoms are well managed and their stress is reduced, they are better able to tolerate their primary treatments and maintain their strength. They avoid the cycle of crisis and hospitalization that can weaken them. Ultimately, this proactive approach recenters the healthcare system around the patient's goals. It shifts the focus from merely treating a disease to caring for a person living with a disease. For someone with a chronic condition, life does not stop at diagnosis. There are still milestones to celebrate, relationships to nurture, and personal goals to achieve. Early palliative care helps make this possible. It provides the support system needed to navigate the complexities of their illness while still embracing the fullness of life, ensuring that they remain the authors of their own story for as long as possible. For palliative care to truly become a standard part of medicine, we must build a stronger system to support it. This requires significant changes in two key areas: insurance policy and medical education. Currently, many insurance plans have outdated structures that create barriers to accessing palliative services. Reimbursement models often favor procedures and hospital stays over the time-intensive, conversation-based care that is the hallmark of palliation. We need insurance plans that recognize the immense value of these services and provide robust coverage for them, whether they are delivered in a hospital, a clinic, or a patient's own home. Reforming insurance is only half the battle. We must also expand the workforce. There is a critical shortage of doctors, nurses, and other clinicians who are specially trained in palliative medicine. Medical and nursing schools have historically dedicated very little curriculum time to the principles of symptom management and end-of-life communication. This needs to change fundamentally. Every future physician and nurse, regardless of their chosen specialty, should receive basic training in palliative care. They must learn how to manage common symptoms like pain and nausea, and just as importantly, how to talk to patients about their goals and fears with empathy and skill. This education should not be limited to formal certification programs. We need to integrate these principles across the entire healthcare landscape. Oncologists, cardiologists, and pulmonologists who treat patients with serious illnesses should all be equipped with primary palliative care skills. This would allow them to initiate crucial conversations and manage straightforward symptoms themselves, referring to specialized palliative teams for more complex cases. This approach would create a more resilient and responsive system, ensuring that more patients receive this essential support without having to wait for a rare specialist to become available. Creating this future requires a concerted effort from policymakers, healthcare administrators, and educators. We must advocate for new payment models that reward value and quality of life, not just the volume of procedures. We must invest in fellowship programs to train the next generation of palliative care leaders. And we must demand that our medical schools produce clinicians who are as comfortable providing comfort as they are with prescribing a cure. By strengthening this foundation, we can ensure that palliative care is not a luxury for the few, but a right for all who need it. The future of palliative medicine is also being shaped by exciting new research. This research is not focused on finding a cure for the underlying disease, but on a different, equally important goal: finding better ways to relieve suffering. Scientists are exploring new medications and new uses for existing drugs to more effectively manage difficult symptoms like chronic pain, severe breathlessness, and intractable nausea. For instance, research into the mechanisms of nerve pain is leading to more targeted therapies that offer relief without the heavy sedation associated with traditional opioids, allowing patients to remain more alert and engaged in their lives. Beyond pharmacology, innovation is also happening in the realm of emotional and psychological support. We are learning more about the profound impact of anxiety, depression, and existential distress on people with serious illnesses. New therapeutic approaches, including dignity therapy and meaning-centered psychotherapy, are being developed specifically to help patients maintain their sense of identity and purpose in the face of mortality. Technology is also playing a role, with virtual reality being used to reduce anxiety and provide patients with calming, immersive experiences, whether it's visiting a virtual beach or revisiting a cherished childhood place from their hospital bed. This research extends to the families and caregivers as well. Palliative care recognizes that illness is a family affair. The emotional and physical toll on loved ones who provide daily care can be immense. New studies are focused on identifying the best ways to support these caregivers, from providing respite services to offering counseling and training to help them cope with the stress of their role. A well-supported family is better equipped to support the patient, creating a virtuous cycle of care that benefits everyone involved. This holistic view is essential for creating a truly compassionate healthcare system. Ultimately, all these advancements, better symptom management, improved insurance, more training, and new research, point toward a single, vital outcome: helping people live with more comfort and dignity. A serious illness should not mean an end to a meaningful life. The future of palliative medicine promises a world where patients have more control over their journey. It is a future where their pain is managed, their fears are heard, and their personal values guide every medical decision. It is a future where we do not just add days to life, but add life to days, ensuring that every person's final chapter is written with as much peace and grace as possible.